Well, a few months ago, I went to see my chiropractor and he wasn't there. There's this young lady who said she could do the job. So she had to prove that she could actually do chiropractic on animals, stand on 2 feet and drink coffee, but she did okay. And most of her patients, though, have 4 feet. And she went to the same chiropractic school that most chiropractors, Palmer School, that college that the guys who work on people do. So anyway, I'm just going to turn it over to Leslie Rogers and let her talk to you about what it does for what kind of therapy, animal therapy that they can do.
Well, thank you all for having me today. Let me see what I can do here. Okay. We've got a few things to talk about today. As he said, I'm an animal chiropractor, first a chiropractor, then certified in animals. I'm also a PEMF practitioner, as well as Trent, my significant other and my business partner over here. So let's get started here. A little bit about us. We got started in 2020 with R&R Animal Therapy. And so going on our 3rd year now. And Trent also has cattle at home. So he raises seed stock cattle and works with them, does that full time. And then when I'm not working on animals, I help him. So he keeps me pretty busy there feeding cattle. And we also have Claire here with us. She is our special guest. We'll do a little demo on her here in a little bit, but she's loves pets. So if you want to come greet her here in a little bit, she would love that. So I know some of you are thinking chiropractic for animals sounds a little strange from the outside looking in, but it does help with joint mobility, helps them just move correctly the way they should. A lot of times with show animals, they are judged on how they're moving and their joint mobility, their flexibility. So that's super, super important in the show ring, especially. And then it just helps with their overall health and restoration of health. So if we keep that nervous system working properly and communicating with the brain and the central nervous system, then that's going to help them live a better life. So here's a video of a calf getting its first adjustment. We had to pull this calf. The mom couldn't have it on her own, so we ended up having to pull it, and it goes kind of quick, so I might have to play it a couple times, but I thought we might as well just get him off on the right foot and get him started. So you'll see me doing some palpation here at first, and then I'll do the adjustment here pretty quick right there. And then he'll do some licks and chews, which is a good sign. Shortly after, he starts getting up and then right away goes to doing his job, and his mom's doing his job right away too. So we like to see that. And then we'll just go ahead and bring Claire up here. This is the PEMF machine, and we'll talk about that here in a little bit. And then this is a block that I use. It's nothing special, just a styrofoam block. People think I've got something special in there, but I usually use it. Yeah, sure. Sorry. I usually use this if I'm working on large animals to stand on, or if I've got a dog here, just to kind of help me. If I'm working on a large animal, it helps my shoulders and helps me get a little bit more leverage above them. And then with small animal, it helps me not have to get up and down off the ground if I don't have to. So if you want to hold this for me. So normally I'll take it for a second. So normally I would go through like a full examination with the animal and watch her gait, take a full history from the owner. But since Claire is our dog, we kind of know her, and with time's sake, we'll just go through. I'll palpate her, go through some range of motion things, and do the adjustment. So I need both hands for this. So if I need to yell at you, I'm sorry. Claire doesn't get off the farm much, so she's a little overstimulated right now, but so she's also had a couple of litters for us. And she's got some hip mobility issues. So I'm used to adjusting her hind end. You can see she's got really good range of motion here in this hip. I don't know if everyone can see me. If you need to stand up, go right ahead. And then this hip has a little bit more restriction. She's not letting me move it as quickly or as fluidly as the other side. So I'll do an adjustment shortly on that. So I'm pressing on her spine, just basically feeling the movement of the spine and comparing it segment to segment. So if I feel something that is a little bit off or it's not moving how it should, then that's where I would apply an adjustment. So she's fighting a little bit back here. So that's just telling me that she's a little bit more pain back there. So she's kind of trying to pull away from him.
How do you know? I mean, that's us as people are gonna whine and cry about where we hurt.
Right.
I know where to take care of it.
Yeah.
How do you know an animal like basically hurt her and they're out of my life?
Yeah, so just how she's reacting to my touch in certain areas, and then with what I'm feeling too. So my fingers and hands are pretty well trained, I guess. In school, right away we start with palpation and feeling movement of the spine. So I might be able to feel something that you might not be able to feel or see. Just going through some shoulder mobility here. A little bit restricted there.
How old is Claire?
Claire is 5.
How's she doing? You ready?
Claire had some injuries.
No, she hasn't. But it is good to just do an adjustment just for maintenance. I don't know who all has been to a chiropractor here, but I know it helps me just stay in alignment and helps me to just feel better overall and keep things moving the way they should.
Now, don't you get animals that obviously you're not used to or haven't seen before that they're gonna actually not, I mean, do they behave well enough that you can do what you need to do? I guess my question.
Yeah, sometimes there are some behavioral issues, or if they are in quite a bit of pain, it does take some time to warm up to them and get them used to my touch and everything. But yeah, sometimes they do fight me a little bit, and that's where the machine comes in. So that can help relax them quite a bit, and I'll talk about that here in a little bit. But let me get through this adjustment, and I can take some more questions here in a little bit.
How often do you do it?
Okay. Did you get it?
That's why we have Trent here. Just in case anything's a little painful for them. You always have to have a handler.
It's okay. Get it back in.
Okay, I'm just gonna check her neck really quickly. You got it?
It's okay.
All right, let's let her down and she should shake out for us. Yeah, so that's just her just telling us she's feeling pretty good now. And she's kind of got a neurological reset, if you will. Oh, yeah. Thank you. Okay, so for the PEMF, that's a pulsed electromagnetic field therapy and helps to reduce the inflammation, helps with relaxation, like I said, and cellular metabolism helps with the blood flow. So gets those muscles released. How many of you have used like a TENS unit? It's similar to that. So you will see some pulsing, and it's pretty relaxing for them, but it also has magnetic fields too. So it's going deeper than just the muscle. It's going to all the tissues and helping with regulation of all that. So we've got a couple videos here. It's kind of a mashup of the MagnaWave working. You'll see some pulsing right away on this heifer here on her hip. And then it'll go into just different things that lots of licking and chewing. So different releases there that they will show you. Oh, I need to go back. So that's all of this is during a treatment. And you can just see how well they feel, how relaxed they are. Lots of releases there. And so it's a lot of people, even if I put it on a person, they're like, I haven't slept that well in so long. And you can see that in the animal's eyes. Their eyes turn down, they're ready to go to sleep and rest and reset themselves. So it's pretty cool what it can do for them, along with the chiropractic and complementing that as well. So we've got a little bit of a before and after of a heifer here that I worked on. She came to me and she was really spazzed out in her back, just super tight, and kept dropping down in her hind end, almost like the nerves weren't communicating to where they needed to. So I worked on her once, and then the after was just a few days after that. So definitely not normal there. Those nerves just are not communicating to where they need to. And she's not moving how she should. So this is just a few short days after. And she is, you can tell with the switching of her tail, she's still sensitive there in her back, but it's definitely way better. And she's functioning how she should. Anybody want to see that again? Or are you guys okay? Okay. And then we have a dog here that I worked on, and she's a Great Dane. So Great Danes have a tendency to have hip issues just because of their growth pattern, and they grow very, very rapidly, just like any other large animal breed dog. And this is kind of a quick video also. So just you'll see beforehand, she's wanting to play with this black dog, but he is not. I mean, she can't keep up with him just because her mobility is restricted. And so I'll work on her here in the video. So she's wanting to go run with him. There's her PEMF therapy, her adjustment, and then that's right after. It was right after. We just turned her out right after, and she wanted to go run with her brother. So is there any more questions for you all?
Yes. So if you're a pet owner and not plugged into animal chiropractic, how would you know to call an animal chiropractor like yourself?
Yeah, so dogs, are you talking about
Just
dogs? or just
animals
any
in
pets?
general.
Okay. Yeah, they tend to not show signs of dysfunction until later on in their injury, if they do have an injury. Just because that's their instinctive thing to do. So they're gonna hide things, unlike humans. So a lot of times they'll stop doing their daily activities just if they ever get up in a vehicle and they can't do that anymore. If they sit a little sideways, if their posture's a little bit off, head tilt, things like that. And then lastly, if they stop eating, that's definitely a sign that they're in major pain.
Would
So-
most people take them to a vet first and then you get referrals, or how? I mean,
with
my first inclination would be, not having had this before, take them to a vet.
Yeah, sure. Yeah, you can for sure go to your vet, and if you still feel like you need to contact a chiropractor, then go right ahead. But they're with our state, they're with the laws, we don't have to have a referral from a vet, but it's nice to be in communication with a vet with that.
And around the industry that we're in. Leslie's kind of out of breath, so I'm gonna take over there for her. But we have vets on call at the ranch. We work with 3 different vets, and closely. Dr. Kyle Onan is our, I guess, probably our most normal vet that we talk with the most. Leslie does get a lot of referrals from veterinarians throughout the state of Oklahoma.
Mhm. We're located in Glencoe, just right outside of Stillwater there. Mhm. Yes.
Is this like pay by the pet size or weight? How are the fees structured?
Well, sort of, yeah. So kind of same thing with veterinarians. Large animals they're going to take a little bit more work. So a lot of times the bill will be a little bit higher for large animals, but dogs. Yeah, yeah. Yeah.
So what are the different variety of animals that you've taken care of, and maybe the largest one or the strangest one?
So my biggest client is cattle, and that's not typically it's not typical for a chiropractor to see cattle. Usually it's dogs and horses. But we have connections in the cattle industry, and so that's kind of where our little world lives. So cattle and sheep, pigs, and goats. Pigs are a little strange to work on, just because you can't tie them up, you can't restrict them anyway, so you just have to move with them and just go roll with the punches, I guess. And so pigs, I guess I haven't really worked on any strange animals, but cattle, I've worked on some pretty big bulls of our own, and they're not the easiest to get to work on, but it is enjoyable. So any more questions? Yeah.
How often do you work on your own dog? Do you have some that come in regularly to you?
Yeah, so since most of my clients are show industry, we typically say once a month is a good maintenance treatment, but a lot of people like to cluster treatments right before they go to a show, just to get them regulated and get them feeling good. We do take them out of their environment when we go to a show, so a little bit more stress is going on, and so their bodies are able to just feel like they're at home. And so with our animals, we do once a month and then we'll cluster some treatments right before a show if we go to a show for the show cattle. The dogs there just about once a month, and then as needed, if I notice anything different happening, if they're not acting like themselves, then I'll put another treatment in there. So yeah.
What is the training and education path to this? Is it like a human chiropractor? Is there a school you go to? And Are there a lot of schools around here that are-
So we either have to be a veterinarian or a chiropractor to be an animal chiropractor. So I went the chiropractic route and got certified in humans. So I'm licensed in humans. And then I did another certification for the animals. And my schooling was in Texas for the animals, in Meridian, Texas. But yeah, there's quite a few around here. They're not they're not, it's not a huge profession. So the demand is pretty good, but yeah, there's not a huge amount of us. There's probably around 3,000 in the country. So not very many of us.
Do you have your like cattle, for example, come to you, or do you have like a set distance you'll travel to people's home or
Yeah.
to their own cattle?
I typically travel just because like I said, I want to keep them in their own environment and keep the stresses to a minimum. So just keep them at their place. If I have to have someone come to me, then we'll do that. But typically I travel. Yeah.
You have, you have a different skeletal makeup of animals and humans. Is there a big difference in the treatment of the two?
I would say yes and no. Just as far as them, how I treat them, they're usually standing. So that's a little bit different. So we don't typically do that with humans. We typically lay you down on a table and get you nice and relaxed. And then, so with them, I kind of have to, let them come to me and let them welcome me first. And it's a little bit, longer treatment time, it seems like sometimes. But yeah, it's the spine is definitely different, the anatomy is different, but you have to kind of just same concept. Yeah.
Do you still work on humans or do you work exclusively on animals now?
So I do special humans. Yeah. I have filled in for a chiropractor here in town a couple of times, and I do see people out of the house every once in a while, but my biggest practice is animals.
One question I had, years ago, we had a Boston Terrier, which had spinal problems
Mhm.
and went to the small animal hospital here. And there they used acupuncture on her.
Yeah.
And it really, you could just see the relaxation immediately.
Yeah.
I was wondering, do you ever use acupuncture or in any of your work? or-
I don't, but I have heard many stories and come across many patients that have used chiropractic and acupuncture, and they've had tremendous results. So yeah, I definitely believe that. Anything else? We do have some handouts here if you all want to take some more information on it. And then we have business cards as well. So thank you all for having us, and thank you for what you do in the community. I appreciate the opportunity today.
Well, let's give Dr. Rogers another great big hand. And we just really appreciate that presentation. Trent, we appreciate your presence here today, and not being the dog whisperer, but being the dog handler. And Ray, thanks for admitting that you have seen Dr. Rogers. So we appreciate that very much.